After the Ilea period, our children were supposed to go back to school. Again, we intensified our activity to make sure that our schools were on high alert. We did not want to cancel either the festive period or the resumption of our schools in Lagos. And as you can see, we had a slight increase around the 18th, 19th, and 20th, 21st, but as of the 22nd, the numbers have started to come down. And as yesterday, we had, I think, just 1 or 2 cases reported. We're yet to clean up the data from yesterday. But the general trend is that the numbers have significantly reduced, and we're not seeing the numbers of cases as we did before. The next slide just repeats this information in graphic detail, and it shows basically the local government areas that were predominantly affected. And you can see the peak there again around the 10th, affecting most of the local governments that I mentioned. Lagos Island, Etiosa, Oshofe were the predominant local government islands. And as the days have moved on, around the 13th, 14th, 15th, even the period covering Ilea and the period covering the resumption of schools, there has been very, very low activity. Of course, we still have patients that are sick from the cholera that are still being managed and in our hospitals, but we're mainly discharging them, and there are very few patients left in our hospitals. We are very, very happy to state that we've not had a single case presenting in any of our schools since the resumption after the break. The next slide just shows you a graphic representation of the intensity of the cases around Lagos. And you can see there in red were the predominant cases where we had the heaviest burden of cholera in Lagos Island, Lagos Mainland, and Koshofe. On this slide, we have the data that represents the total number of suspected cholera cases. And that number is 579. Out of this 579, we have unfortunately experienced 29 deaths. Most of these deaths were caused by patients presenting very late at a stage where we could not resuscitate them because they had severe dehydration, and many patients were actually brought in dead. Out of all the samples we were able to collect, we were able to identify Vibrio cholera. So this is indeed a confirmed case of a cholera outbreak by a subtype 01 that is known to us to be very contagious and to cause significant sickness in those that contract it. The next slide shows you the distribution between our public and our private hospitals. On this slide, you can see that majority of the patients presented to our public facilities, either our secondary general hospitals or our primary healthcare facilities. So we had 209 suspected cases in our general hospitals and 193 in our primary healthcare facilities. We also had a significant number presenting to private sector hospitals with 152. Our military and police and security facilities, and our tertiary hospitals, Lasuth and Luth. The next slide shows you the general principles of responding to public health facilities, public health emergencies. Just like we did during COVID, under these circumstances, the government is in complete control with an incident command structure led by His Excellency the Governor, Mr. Babajide Sanwo-Olu, the Deputy Incident Commander, who is the Commissioner of Health, myself, and then the Emergency Operations Center, which is managed in the Ministry of Health with multiple pillars representing different ministries, agencies, private sector, donor partners, and international organizations. One of the main principles of curbing the spread of a dangerous pathogen is to offer treatment absolutely free of charge of any suspected case in our government hospitals. That makes sure that we can attract patients to our facilities without them worrying that they have to pay. It allows us to remove from community patients who are infected. Thereby, we're able to slow down the transmission and bring an end to an outbreak.